The purpose of this thesis is to analyze the importance of the role of the interpreter in the Roman's medical health department. The reason why I chose to research this topic, other than my great passion for medicine, was to find the best path a foreigner could follow in my city. I myself have had health issues and having been hospitalized many times, I have had the opportunity to witness the sometimes difficult communication between healthcare personnel and patients because of the language. During one of my recoveries, there was an Irish patient who, while waiting to be diagnosed, was trying to communicate with a nurse, but the nurse could not understand her. The patient was complaining about a pain of the abdomen. The nurse put the patient's life in jeopardy. I helped them both translating what the woman was saying. Finally, the medical staff arrived quickly and the woman was operated immediately. She had an intestinal obstruction. During another incident, I happened to translate for a French patient who was sick. He looked like he was having a panic attack and he was shouting "J'ai mal au cœur" in French, which means I feel nauseous. Doctors immediately called the cardiologist because they had not understood that the patient was actually having mental issues. The man tried to cut his throat with a small knife. Bottom line, the medical staff saved his life, apologized, and thanked me for the help. Those are few of incidents happening during my bad health period. Fortunately today, some healthcare structures in Rome have adopted the use of interpreters figure because they have understood its importance. Have you ever happened to find yourself at the ER while on holiday in a foreign country? Have you ever needed to go to the doctor while living in a foreign country? How about prescription medicines and not being able to understand the instructions given because you do not speak the language? In all of these situations, it will be very useful to have a professional medical interpreter to help you, but often this is not possible. Sometimes the family or children of the patient act as interpreters only because they speak the language. I believe this is a huge responsibility. The healthcare interpreter has acquired the exact medical terminology to be used in this field. Therefore, they are sometimes necessary to save patients' life. Some hospitals in Rome have interpreters and some don't. The Eurostreet Translation Service, one of the major agencies that offers this service, fortunately is used in several hospitals including Bambin Gesù structure. Children are truly taken care and so are their families in this hospital. I remember a French family from Grenoble who had come to Rome for vacation with their 2 children, and unfortunately one of the 2 children was sick during a visit to the Vatican Museum. An ambulance took them immediately to the Bambin Gesù, and they were immediately put in contact with an interpreter provided by Eurostreet Translation Service. Anna, the interpreter, arrived physically at the hospital and gave her help and support to both doctors and family. Patrick, the child, needed to have a surgery on the mitral valve. Anna supported the family for the entire time of Patrick's recovery. Patrick's family consider Anna part of the family today. This is an example of professionality, humanity, and empathy that are required when you are a health interpreter. During my investigation, I have managed to interview doctors and patients in order to have a general and clear overview of the situation. Part of the doctors that I have interviewed do not feel safe when they have to deal with foreign patients. Others, thanks to their translation services, feel more comfortable. I truly believe that each hospital in Rome must have an interpreting service 24 hours per 7 days. In conclusion, I would say that we are slowly but surely getting better. Doctors have understood that the patient's personal history is as important as his or her pathology, because listening to the patient can sometimes help to better understand the causes. There should be a reciprocal trust between doctors and patients. I have seen both smiling and expressing relief after realizing they have been understood thanks to the help of an interpreter. Transference that occurs between doctors and patient is inevitable. Every human being has an impact to another. There are some currents of thought that believe that detachment and distance permit a more lucid and effective healing process. I do not agree with this theory because a patient has a past, a present, and hopefully a future life. With transference, the doctor has the capability of suggesting a specific cure for the patient. Patients have a name, a life outside the hospital, maybe a family, a nickname, children, friends, or a dog before becoming patients. Therefore, when a patient happens to be a foreigner, an additional effort must be made, and without an interpreter, all efforts of communication will be in vain. Doctors and patients have the same fears when they do not understand each other. Death is the major fear for both. But what is worse than death is indifference. The best gift doctors could give to a sick person is not only to delay death, but to improve the quality of his or her life. Listening to them about their feelings, passions, dreams, sharing jokes, tears and laugh, and also moment of awareness. If doctors were left to cure the illness only, the outcome could be positive or negative. But if they focus on the person, it would be a win-win situation no matter what the outcome. I can assure you.